Hi, my name is Hager, and this is my demonstration of the aseptic technique with the compounding of pediazine. Okay, so we want to make sure to start off with a clean hood and that it is empty. So off camera, I'm wiping down all the items that I'm introducing into the hood with 70% IPA. So I wiped down the dextrose and made sure to put the ports facing towards first air. And now I wipe down the sterile water. And now I wipe down the pediazine. And I wipe down the syringe. And I wipe down and place the needle. Now I grab a few alcohol swabs. So I made the mistake of putting the alcohol swabs right underneath the syringe and needle. So by placing the objects in front of each other, the chance for contamination has been increased as airflow is being blocked. So I just wanted to point out that the items are 6 inches from the edge of the hood and 3 inches from the sides and back. And I positioned the items apart from each other enough to maintain unidirectional airflow. Okay, so now I'm going to take 70% IPA and wipe down my gloves, making sure to allow them to dry without waving my hands around. Okay, now that they are all dry, I'm going to open up an alcohol swab and wipe down my sterile water, making sure to wipe it 3 times towards me. Now I'm going to take a new alcohol swab and wipe down my pediazine 3 times towards me. Note that I made the mistake of not wiping down the right port of my dextrose. So now I'm going to open up my syringe, making sure to keep the critical site facing towards first air. Okay, now I'm going to take my needle and make sure that it is the right one. Now I'm going to take that needle and make sure to open it in a way that the critical site is facing towards first air. Now I'm going to take the critical site of the needle and connect it with the syringe. Now I'm going to make sure I have the correct diluent, which is sterile water. And now I'm going to check if I have the correct drug, which is pediazine. Now I'm going to take my needle and loosen up the plunger by pulling in some air. Now I am taking the needle and beveling it into the sterile water. With the vial upside down and first air able to reach the critical sites, I inject some air into the vial and then allow fluid to flow in, and then inject some more air, allowing more fluid to flow in. And I repeat that until I have the 5 mLs that I need. I also check to make sure that there are no air bubbles in the syringe. Okay, so now taking the Pediazen, I'm going to bevel the needle into the vial. Note that I made the mistake of injecting all of the sterile water at once. What I should have done is injected a portion of the sterile water, pulled out some air, then injected another portion, pulled out some air, and then injected the last portion. Now I'm reconstituting the sterile water in Pediazen. Note that I should have kept the needle inside while reconstituting. Okay, so now I'm going to withdraw 5 mils. I should make sure that the vial is upside down and that the critical sites have direct access to first air, which they do not. Okay, now that is better. Okay, so you want to make sure to keep the port towards first air. And I'm just going to go ahead and inject it right in. Now I'm going to use the one-handed technique to cap the needle. Once the cap is securely on, I'm going to twist off the needle off the syringe. Okay, thank you for watching.